Hello, welcome back. The topic today is how anemia affects our energy level. Anemia, we all know, is a reduction in the hemoglobin level or red cell blood count. So, what is the function of this red cell and hemoglobin? So, they carry the oxygen to the target tissues. From the lungs, they take the oxygen and goes to the target tissue. And our body tissues, all the cells function only on these two things. One is oxygen and the other one is glucose. So whatever you eat, whether it's a fruit or fast food or anything that is converted into simply to the sugar. So the sugar and oxygen is carried by the blood, generally the RBC and their hemoglobin to the target tissue. Suppose there is a less hemoglobin, then the target tissues won't get this glucose and oxygen. So the tissues can get destroyed. And not only that, the repair work, suppose something goes wrong in the tissues, the repair work will not happen efficiently. So this is the main reason you get easily the tiredness. So in anemia, what are the signs and symptoms? Usually they feel tired, lethargic, sleepy, they forget everything, lightheadedness, pale skin, cold peripheries. So their heartbeat will be very high. Reason is, suppose a normal healthy heart pumps blood 70 times, 70 beats per minute to give the oxygen and sugar to the tissue. Now the hemoglobin is very low, so instead of 70, it has to beat 100 times or 110 beats per minute. So in a minute, suppose there is 30 to 40 beats is increase. So naturally in a day, how many beats the heart has to work? So they get easily tired. Not only that, it affects the heart. So that is why we have to correct the anemia. Not only that, so if the tissues cannot get the proper perfusion, proper oxygen, proper glucose, then it can affect any tissues, your kidney, your muscles, your brain, anything can be affected. And the immunity part, if there is less hemoglobin, it directly affects the immunity. So the immune system, so they can easily get infections like urinary tract infection, upper respiratory tract infections. They are prone for infections. So the immunity goes down. So the repair work also is not. See, even the doctor, suppose they give some medications, this has to be carried by the blood. So if there is a less RBCs and hemoglobin, the medicines cannot be carried out efficiently. Even the repair work cannot happen. And not only that, not only the energy level, the stamina also goes down. So suppose they are anemic, they can do within a short time workouts they can easily do. Say 5 minutes of walking, they can do easily. But if they have to walk for 30 minutes, so the enduration, they need more time to do something, then they cannot do it. So the heart itself will force them to take rest. So they feel always tired. They don't get sleep. They're restless. So, and anemia, we always say any adult, the hemoglobin should be more than 13. Anything less than that has to be considered as anemia. And if it goes more than 10, below 10, then it has a lot of consequences. So, commonest cause of anemia is iron deficiency anemia. We all know that. But other vitamin B12, iron, vitamin B12, folic acid, and protein, these are very essential for hemoglobin and red cell production. So these things also has to be taken care. And suppose you have any of these signs and symptoms and you feel tired all the time, confused why I'm having all these things, probably you're anemic, and go to the doctor will examine you, and if he finds the anemia, then he will look for what could be the reason for anemia. It could be because of nutrition deficiency. Suppose you are a vegetarian and you take only fixed kind of diet, so probably you can get anemic. Or if you're losing blood from the body, women every month they lose because of the periods, so they can get anemia. Or suppose they have piles and they bleeding, so easily they can get anemia. So look for the root cause, and according to the deficiency it has to be treated. Otherwise, right from your the well-being, the quality of life, immunity, everything will go down. So if you have anemia, treat it correctly. See the doctor, get yourself examined, look for the root cause of anemia, and get the proper treatment. Thank you.